Exhaustion and Recovery. I would like to start by sharing a story with you about 12-hour days, most weekends, never said no to new projects. In February, I was home from work for about a week. After she recovered from that, she often had colds and caught the flu again, several times following that episode. And none of these illnesses were serious, but they left her with less energy each and every time. She couldn't gain back the energy that she had. And work began to feel like it was too much. What she used to enjoy, she didn't enjoy anymore. She couldn't concentrate. Her focus was cloudy. Her memory not as sharp. And she felt tired. She needed coffee to get going every morning. She needed a mid-afternoon bit of chocolate or another soda or another cup of coffee to get her going about 3, 4 o'clock at night. She was irritable. She was impatient. And about 6 o'clock, she usually felt better after she had dinner. It gave her a little bit of energy. But then about 9:30, she started to bonk again. And then she'd have another second cup of coffee. And she could probably push on until 11 o'clock and catch her second wind. Her food habits changed. She craved sweet foods all the time, donuts, and she really craved salty stuff just as much as she craved sweet stuff. She skipped meals, and she felt exhausted. She began to feel depressed as well. So she went from doctor to doctor to doctor, and she was told, blood tests were run and physicals, and they ruled out all the big, bad, and the uglies, and they basically told her, here's some antidepressants and anti-anxiety meds. You're fine. You're normal. Just go home. You're getting old, right? And so she went through this for years, suffering. She had a cabinet full of medication, and she still felt like garbage, tired, exhausted, depressed. Unfortunately, this is an all too common story of adrenal fatigue. Many variations of it, but all too common. And it goes undiagnosed and missed, undetected and untreated, and then leads to more serious problems down the road. So today, I am going to adrenal glands. I'm going to teach you how to detect if you have adrenal fatigue or if you're suffering with that. Importantly, how to recover from it naturally. So let's get right into it. And let's talk about your adrenal glands. What are they? So your adrenal glands are called the glands of stress. They're small. They're about the size of grapes. And you have 2 of them, and they sit right on top of your kidneys. Their job is to help you deal with stress. That's their job. Ranging from injury to physical trauma, emotional trauma, respond and adapt to stress. And that's why they're called the glands. So the physiology of the adrenals, they affect every tissue, gland, organ, and system of your body. They affect the way you think and feel. The adrenal glands influence the way you respond to every change in your internal and external environment. So the adrenal glands, what they do is they secrete hormones that influence all these processes in the body. Utilization of carbs and fats for cardiovascular and gut health. Conversion of fat and protein into energy. Minimizing allergy or response to allergy. Distribution of stored fat after menopause. The major source of sex hormones comes from adrenal glands. Yes, you still make hormones once you reach menopause. So many people think they don't. You do. Blood sugar regulation is also influenced by the hormones that are secreted by the adrenal glands. So as you can see, there's a lot going on and a lot connected to these adrenal glands. So the bottom line is, when it comes to the adrenals, you cannot live without adrenal hormones. So your health is dependent on the health of your adrenal glands. Unfortunately, with adrenal fatigue, about 80% of adult Americans suffer with some form of in their lifetime. However, it is often misdiagnosed and untreated. So the medical term for adrenal fatigue is hypo, physical, emotional. We're going to talk more about that. But in response to all those forms of stress, those adrenal glands pump out a certain amount of steroid hormones to respond to that stress. And when that's happening the way it needs to be, in the balance and in the amount that it needs to be, your adrenal glands are functioning properly and you feel healthy. You are healthy, your body are healthy. When you have too much stress, physical, emotional, environmental, psychological, we'll talk more about life, get increase of adrenal hormones that your adrenal glands can put out, resulting in adrenal fatigue, mild or severe. Although adrenal fatigue is not something readily identifiable by a growth on your finger or measles, adrenal fatigue is a collection of signs and symptoms that usually makes a person feel unwell or gray. A person will often use coffee, sodas, and other stimulants to get going in the morning. Can't function without that cup of coffee. They're fatigued, they're tired, run down, feeling an inability to keep up with life. They may have erratic or abnormal blood sugar levels. You'll hear people say, I have to eat, I have to eat, I have low blood sugar, I have low blood sugar. Well, that means something. That means something, that's a sign. They may have allergies, arthritic pain, decreased immune system, or they get colds a lot. PMS, again, PMS is not normal, it's not okay. It tells you something. It tells you that your body is not able to respond to the stresses in your life. Difficult menopause, because adrenals have an effect on your mental state. If your adrenal fatigue continues, you can have increased fears, anxiety, depression, intervals of confusion, difficulty in concentrating, bad memory, recall, less tolerance, and easily frustrated. And last but not least, insomnia is another sign and symptom of adrenal fatigue. And as your condition worsens, your adrenal fatigue, it lays the foundation for other conditions like respiratory conditions. So bronchitis, pneumonia, allergies. If you're constantly dealing with allergic reactions, rhinitis, asthma, frequent colds, chronic fatigue syndrome, hypoglycemia, diabetes, on alcoholism. So it can become very serious if these adrenal functioning the way they need to be. So the surveys you filled out, I want you to look at that. And if you checked off more than 3 of the symptoms in the section saying adrenals, then you may be suffering with adrenal fatigue. And we definitely want to address that before the condition gets worse. And we'll talk more about how to do this in the last couple slides. So what causes adrenal fatigue? How do we get there? Well, I've got one word for you. Stress. That's how we get there. And stress can come in many different forms, right? It can be physical stress. For example, my job. Very physical job. I don't stop moving when I get in here for 4 or 5 hours straight. It's physically demanding. And I have to be very careful to make sure that my adrenals stay replenished and that I do things that I'm teaching you here today to keep my body strong. Emotional stress, we all know what that is, psychological, environmental, infectious, and a combination of these. So toxins, infections, death of a loved one, repeated stress, smoking, lack of sleep, poor eating habits, sugar and white flour products, medications, lack of exercise, negative attitudes and beliefs, financial pressure, all of this, stress, and causes trouble with the adrenal glands. And what's interesting is that it doesn't matter what form of stress it is, the adrenal glands respond the same. So if it's a car wreck, or if it's a bad marriage or a bad relationship that's in your life, you're going to respond exactly the same. The adrenal glands are going to react to them. So it's important to note that there are different components of your lifestyle that can lead to adrenal fatigue. Because it's not necessarily that one day of work. It's the ongoing stress of lack of sleep. If you don't sleep well, don't ignore that, because that will lead to adrenal fatigue. People that work the night shift and have done that for years, and sometimes they'll boast about it. I can do it. Yeah, but not issues, not without problems. Or food choices. This will catch up to you, and it'll catch up to your adrenal glands. Using food and drinks as stimulants when you're tired, staying up late even though you're fatigued. Again, listen to your body. When it says, I'm tired, and you feel tired, go to bed. Constantly driving yourself, that type A personality, which I don't know anything about, can lead to adrenal fatigue. Lack of enjoyable and rejuvenating activities. So if you're not giving those adrenal glands some of that feel-good stuff, it will catch up with you. So here's an example of somebody that fits the bill for adrenal fatigue. Professional student, mother of 2 or more, and little support, single parent, unhappy marriage, extremely unhappy and stressful work conditions, self-employed, drug or alcohol user, alternating shift work, all work, little play. So one or any of those combinations is a component of a lifestyle which can lead to adrenal fatigue. Life events that lead to adrenal fatigue. And what's interesting, it may not just be one life event. That you may be able to handle that. But if we have 2, 3, 4, back to time, hear people say, I never felt the same. I lost my mother, my father, and I had a really bad car wreck, and I moved all in the same year. Right? I've heard that. I do exams with patients, and they tell me this stuff. Well, guess what? They are definitely going to need some adrenal support, because this is cumulative. So life events, unrelieved pressure, and work at home, at work or homes. Any severe emotional trauma, death of a close friend or family member, major surgery, prolonged or repeated respiratory infection, severe burns, including severe sunburn, head trauma, loss of stable job, relocation without support, repeated chemical exposure. So, and you never felt the same after that, but you add 1, 2, 3, 4 things on top of that, you're definitely going to have weak adrenals. And effects of the stress are cumulative. So it could be a lifestyle, could be an event, but then we can put poor diet on top of that. Research that you're not vegetable today to produce the hormones that it needs. So we need to be eating healthy. We need to be eating vegetables. Usually precede adrenal fatigue. And we may be weak from birth. If mama suffered with adrenal fatigue, she already had 4 or 5 kids to take care of, and then with you running around with no energy, her adrenals are depleted, then with weak adrenals. So the next few slides, I have some illustrations, cartoons of people suffering with adrenal fatigue. These in here because we can highlight them. I think it's a really good way to see if you fit into that adrenal fatigue category, so you know best what you can do to treat yourself. So signs and symptoms of adrenal fatigue. The first one up here, difficulty getting up in the morning. So if that's you, most likely adrenal fatigue there. Fatigue not relieved by sleep. So you may sleep 9 hours, but you're tired. I sleep, but I'm still tired. Craving for salt or salty foods. Lack of energy. You know, Saturday night, all your friends are getting together, going somewhere, and you'd rather sit on the couch. Okay, lack of energy. Increased effort to do everyday tasks. Can't even clean the house when that's typically what you do every week, and energy for that. Decreased sex drive. Decreased ability to handle stress. Increased time to recover from illness, injury, or trauma. Maybe you've noticed every time you get sick, it takes you longer and longer to recover. Lightheaded when standing up too quickly. Increased PMS. Feel like you're getting more irritable with people that time of the month. Symptoms increase, skip adequate. People will make jokes about that, right? If I don't eat, the horns come out. That's a problem. It's a symptom. Listen to it. Mild depression. Less enjoyment or happiness with life. Decreased tolerance. Don't really wake up until about 10 a.m. until those 2 cups of coffee kick in. Feels better after evening meal. Get that surge of energy after you eat. Thoughts less focused, more fuzzy. Memory less accurate. You know, of course, we're told you're just getting old. You're just getting old. You know, and I went through this. It's one of the ways that I discovered adrenal fatigue was realizing that something was going on with my body. And all of my doctors were saying, you're getting old. I was 36 years old. You're getting old. So although these might be quite humorous, adrenal fatigue really isn't. It's the symptoms of them, and the illness itself is not humorous at all. So let's talk about how you can test yourself to see if you have adrenal fatigue. So some of the things you can do at home. Number one is contraction. So what you're going to need is a pen light or a flashlight, and you're going to shine this into somebody else do it. Normally, the pupil eye will contract as long as the light is being shown on it. But with weak adrenals, the pupil will not be able to hold its contraction, and it will start to dilate again. That's a sign of weak adrenals. If you have mild weak adrenal, it may not show up. Another test that you can do at home, if you have one of these blood pressure cuffs at home, test your blood pressure. Lay down for about 10 minutes and get calm and put that cuff around, test your blood pressure. Then what you want to do is stand up, and right after you stand, test your blood pressure again. Normal blood pressure will rise 10 to 20 millimeters per mercury when you stand up. When you have weak adrenals, the blood pressure will actually drop. That's one of the reasons why you get dizzy when you stand up. So again, in mild cases, this may not show up. Another test is Sargent's white line. And for this test, all you need is a pen. And basically what you do is make sure the pen point is not out, and don't draw on yourself. Take the dull end and basically run that pen on your skin. And what you should normally see, the line will turn white, but it'll redden quite quickly within a few seconds. Weak adrenals, the line will stay white for about 2 minutes and will also whiten. So again, with weak adrenals, this might not show up. If you go to a doctor's office, an MD that is, and you say, I want to be tested for adrenal fatigue, a lot of times they won't. They really don't do much about this. But if you persist, they may do a blood or a urine test. And again, it's only accurate if you have severe hypoadrenia. In a chiropractor's office, my office, one of the things that we can do if you want to know for sure is you can do a saliva test, and we can test your cortisol levels and test your adrenals and see how weak or how strong your adrenal glands are. So now we have discovered that we have adrenal fatigue. What do we do about it? Well, fortunately, the good news, most of what you have to do to repair your adrenal glands is stuff you have to do on your own. There are some things that, some supplements that I'm going to talk about, but a lot of it is lifestyle changes that you need to make. So let's dive into that. So number one, you want to address your adrenals through your lifestyle. Just find the health drain in your life, get proper sleep, relaxation, response exercises, exercise. Number two, and we'll talk about those on the next couple slides. Number two, you want to try and follow the adrenal diet, which I'll go over again on the next couple of slides. And then add a few supplements and herbs to your diet. So lifestyle. This is simple. The exercise is simple, but actually following through with it, acting on it, is not so simple sometimes. So basically, this is easy. This exercise is just drawing a line down a blank piece of paper, and you can do this on the back of your notes if you'd like, and write good for me on the left at the top and bad for me on the right at the top. And basically, you want to list all the things that you're currently doing in your lifestyle, in your life, that are good for you, and do the same thing what's bad. And this could be activity, this could be foods that you're eating, these could be beliefs, thoughts, relationships, it could be anything. Write it down. Write it down. And the life of the bad for me. What's really, really draining me? Circle them and work on eliminating those. Not until you really start working on this stuff are you going to be able to heal from adrenal fatigue. Sleep. Sleep, I cannot tell you how important sleep is. I am neurotic about sleep, and I'm that way for many reasons. I need it for my job, for my life, for my health, but it helps you in so many other ways to heal from many things going on with your body. And when you have adrenal fatigue, it becomes very, very important. So when to sleep is just as important as getting to sleep and staying asleep when you have adrenal fatigue. It's important to go to bed before 11 p.m. when you have adrenal fatigue. So you want to be in bed no later than 10 p.m. You want to be asleep by 11 p.m. Stay in bed until 8:30 or 9 a.m. if you can, even if it's on the weekends. Even if you're not sleeping, you're just laying there. The adrenal studies have shown that the adrenals really repair in the mornings, 7 to 9 a.m. in the morning. It's a restorative time for the adrenal glands. But you also have to go to bed earlier. And if you're one of those, why I go to bed late, I'm a night owl, but you're suffering with adrenal fatigue, you have to make that change. And you will. You'll be able to do it. It just takes time. You have to force yourself to go to bed sooner. Waking up, if you have a problem waking up between 1 and 3 a.m., it could be too high or too low cortisol. So try doing a little bit of a protein snack before you go to bed. Bite of cheese, peanut butter, something to keep that blood sugar level stable. Throughout the day, it's also important to take short rest breaks if you have adrenal fatigue, which means just laying down horizontal, great for the adrenal glands, even if it's for 15, 20 minutes, lying horizontal. You don't have to sleep, just lay. And that's a great way to help those adrenal glands replenish themselves. Here are some ways to help improve your sleep. Go into bed before 10 p.m. and stay there until 9 a.m. whenever possible. Get enough physical exercise during the day. Avoid coffee, caffeine, and chocolate any time of the day. So if you have identified that you're suffering with adrenal fatigue and you have sleep issues, you really want to eliminate. You want to take this stuff seriously. If you want to sleep better and you want to heal, stop drinking coffee, stop eating chocolate, and stop drinking sodas.
What about decaf coffee?
Yeah, that's fine. It's the caffeine. Okay. So, yeah. Avoid using computers and TVs after 8 p.m. Close it down. Close it down. 8 p.m. It stimulates those brain waves. Taking calcium and magnesium along with a multivitamin with trace minerals at night will help you sleep. And we'll show you that at the end of the presentation. Take adrenal extracts at night, a half hour before bed. We have one called regimen that works really well to help relax your body. We'll talk about that at the end. And shut off all the lights, the LED displays, keep your room as dark as possible. All of that interferes with your brain's ability to get into that sleep mode. My husband makes fun of me. He's like, you're going to get the cave ready because any little light, it's gone. Blinds are pulled. Like I said, I'm pretty neurotic about my sleep, so I do whatever it takes. And shutting off all the lights is really important. So exercise, well, relaxation response exercises are really important. And this involves meditation and breathing. And studies have shown that this is very important for people with adrenal fatigue. Herbert Benson, he's a medical doctor, a Harvard cardiologist, performed a series of studies on meditators and the effects on their bodies. And he proved that the body shifts from sympathetic, which is your fight or flight response, the stress response that your body naturally has, to parasympathetic, which is that calm, we call it the feed or breathe system of the body, quite fast and consistently when you work on relaxation response exercises. So some of these exercises could involve belly breathing, breathing deep versus being a shallow breather, slowing down your breath, counting your exhalations, repeating affirmations are some examples. I foresee a workshop on relaxation response exercises. Another way to help get your body and your brain into this relaxation mode is neurofeedback, which we offer at the office. That can help retrain your brain waves to relax and calm down. So exercise, it's important to know exercise for adrenal recovery. Exercising will force you to breathe rapidly, which expels those volatile gases out of your body, which can become harmful when they build up. And exercise is known to normalize cortisol, insulin, blood glucose, growth hormone, thyroid, and other hormones, and can decrease depression. The exercise has to be enjoyable, though, because again, if you're putting yourself in a situation where the exercise is stressing you out and you already have adrenal fatigue, it's not good for you. So start with exercise that's relaxing, yoga, going for a walk, something that's good, but it's to do this. Now, I think we would all agree that even when you're having the best of times and your body is in great health, that food is important. Well, even at the worst of times, which is what's happening with adrenal fatigue, your body is definitely at its worst, food becomes very important. So what we eat, garbage in, you're going to get garbage out as far as cells in your body. So your diet is very important. And Dr. John Tintera, a medical doctor, this was published in the New York State Journal. We cannot overemphasize the proper diet when it comes to managing hypoadrenal. So what to eat is important when you have adrenal fatigue. I'm going to repeat that. When to eat and what to eat. When to eat and what to eat. So when to eat. People with adrenal fatigue tend to have low blood sugar. It goes hand in hand. So you need to eat quality food at regular intervals. You need to eat before 10 a.m. as well. You wake up at 8 or 9 and you're waiting till 11 or 10 to eat. Not good. Wake up, eat. Wake up and eat. Eat an early lunch before bed. Eat a couple bites of a high quality snack. So let's talk about what to eat. And it's important that we combine all three of those because they break down into glucose at different speeds when you eat them. So it's important to combine the three so that you're keeping your blood sugar level steady source of energy throughout the day. Salt craving is a common sign of adrenal fatigue. So eat it. Use salt. Use sea salt. Use it. Eat it. Okay, get it in your diet. Eat 1 to 2 tablespoons of flaxseed oil sprinkled on meats, vegetables a day. Avoid all fried foods and hydrogenated and partially hydrogenated oils. People with adrenal fatigue tend to have a very sensitive to the rancid oils, and those hydrogenated and partially hydrogenated oils go rancid, and we react to them. So keep them out of your diet. Avoid these foods: cakes, pies, donuts, cookies, other foods containing white flour, sugar, and chocolates. Again, they mess with the blood sugar balance, and weak adrenals are already dealing with blood sugar issues. Avoid the drinks: coffee, colas, alcohol, black tea, and hot chocolate. These rob the body of energy, and we need as much energy as we can get when we have adrenal fatigue. So the supplements for adrenal, very important part of adrenal recovery. And we've been using these supplements for a very long time in this office and have had great success with them. So if you are dealing with mild adrenal fatigue and you tend to want to maintain your adrenal health, you work in a stressful environment and there's just some stresses you can't get away from, you may want to take adrenal supplements ongoing. Typically, we take the adrenal supplements until we are functioning again, those adrenal glands are working, and then we come off of it. But if we still remain in stressful situations, then we want to continue supplementing on a maintenance program. So these are the supplements that you have mild adrenal fatigue: multivitamin, calcium and magnesium, MG, and adrenal, which is Adrenal. And we have all of those if you would like to look at those. If you have moderate to severe adrenal fatigue, what you want to do is follow this protocol for at least 90 days until your symptoms resolve. You'll know. Desiccated adrenals, drenotropin, PNG, licorice, high grade, and basically then stepping down from there and going to the mild or the maintenance at that point. So a summary for adrenal recovery: it's important for you, and you can pull out your form there, because when I do workshops, a lot of times I don't want it to just be a jacuzzi experience where you come and you get in the jacuzzi and it feels good while you're here and you're listening to me, but then you leave and you do absolutely nothing. You get out of the jacuzzi, you dry yourself off, and you go back into your life. It felt good while you were in there for 10 minutes. Thing for you. Well, I want you to utilize these workshops to make changes in your life. So grab out that piece of paper and let's write down what we are going to address in our lifestyle. What health drains? What is draining you? Number one. And what are you going to do about this? Write it down. What's your due date? If you want me to hold you accountable, then you can give me a copy of this on the way out. Be happy to do that. But write it down. What is one thing that you can remove from your lifestyle that's sucking the life out of you and your adrenals? B, proper sleep. If you're not sleeping this, or you come in for your adjustment. Response exercises. Are you into that more? Circle it if so. Proper exercise. Are you exercising? If not, what are you going to start doing about that? What type of exercise are you going to do? Write it down. And when are you going to start? Number two, as far as your adrenal diet that you're going to start, what do you need to eliminate from your diet today? Just pick one thing. You don't need to tell me that you're going to become paleo and cut out grains and chocolate, and just one thing. Start small. Pick one thing that you're going to work on. What do you need to add to your diet? More vegetables? More fruit? Flax seeds? And if you suspect you are suffering with adrenal fatigue, do you think you're severe, moderate, mild? Circle. And we'll help you with that on your way out. So in closing, I just want to talk to you, and you may have heard of a man by the name of Norman. In the book Anatomy of an Illness, he describes his struggle with a debilitating ankylosing spondylitis, and he was told eventually become paralyzed for life. Well, this was not acceptable to him. He was not going to take that as his prognosis. So he did some research. And in his research, he found, what he discovered was that the anti-inflammatory resolves secreted by the adrenal glands are extremely important in overcoming the effects of ankylosing spondylitis. So further research, he found that laughter is something that could stimulate those adrenal glands. And some vitamin C and changing his lifestyle. So he started watching movies, comics. He to the patients around him. They had to move him to his own private room. He laughed and he laughed and he laughed. Guess what? He laughed himself into health. He was able to sell these ankylosing. So all of the elements that we covered in this workshop when it comes to adrenal health, lifestyle, sleep, exercise, breathing, meditation, all of this very important factors in recovering from adrenal fatigue. But most importantly, don't take yourself so seriously. Remember to laugh because it's good for you. Thank you so much for your time and attention today, and I'll be happy to answer any questions that you have.